We are moving on to our next speaker. Dr. Ren Minghui is the WHO Assistant Director General for Universal Health Coverage in communicable and non-communicable diseases. He is going to give us our plenary talk. In his role, he oversees a complex portfolio of technical programs that cover HIV, viral hepatitis, TB, malaria, NTDs, STIs, non-communicable diseases, mental health, and substance use. Wow. He currently represents the WHO on the boards of the Global Fund, UNAIDS, and UNITAID. Prior to his appointment as Assistant Director General, he spent nearly 30 years working in public health, including Director General for International Cooperation in the National Health and Family Planning Commission of the People's Republic of China. In China, his work initially focused on health policy and health reform, and then later on international health cooperation and global health governance. Dr. Ren is a medical doctor and has a Master of Public Health and a PhD in social medicine and health. So let's hear from Dr. Ren.
Yeah, we could let Mr. Ren to speak. So on my part, I'm very glad to share with Melissa, and thank you very much for joining the opening, and we saw our friends and the colleagues enjoy a great 3-day conferences. So I will finish that.
Distinguished participants, ladies and gentlemen, on behalf of the World Health Organization, I would like to express my sincere appreciation to the organizers for this invitation to address you. Today, we are facing unprecedented health, social, and economic crisis. No country, no community, and no individual has been spared, and devastation meted by COVID-19 pandemic, which is touching every aspect of our daily lives. As the future remains uncertain, the whole world is desperately pinning its hopes on science to find a magic bullet to end the epidemic, to return us to the world we knew before 2020. The most prestigious scientists, clinicians, and institutions around the world are joining with the government, community, donor, and industry in a race to research, develop, and produce new diagnoses that are reliable and rapid, safe and affordable therapeutics that are prevent illness and save lives, and ultimately, vaccines that are reliable, affordable, and can be delivered to all. Experience from past epidemics and pandemics remind us that there is no magic bullet, that success will only be achieved through the sustained and long-term actions implementing a comprehensive package of programmatic public health policies and evidence-based interventions and services. Even in the absence of effective vaccines and patent therapeutics, a number of countries and communities have successfully controlled their COVID-19 epidemics and saved countless lives. This has been achieved by implementing simple and comprehensive public health measures, which unfortunately are neglected in many countries. Ladies and gentlemen, we can learn much from other communicable diseases, including those that has triggered health emergencies, such as Ebola and Zika. Those that has resulted in devastating pandemics, such as Spanish influenza and polio. Those that started as acute health crisis and evolved into chronic health threats, such as HIV and hepatitis C. And those that has remained epidemic in certain populations for the centuries, such as tuberculosis and syphilis. In every case, communicable diseases control, elimination, or even eradication has depended on well-informed strategies and plans, a set of comprehensive evidence-based interventions, well-functioning health and community systems that can deliver services to those in need, and adequate resources to ensure the sustainability of the response. We have witnessed the extraordinary power of vaccines with the eradication of smallpox, the pathway to eradication of wild polio virus, and the control of measles epidemics. But the success of the programs for the vaccine preventable diseases is dependent on embedding vaccination services within primary health care and community delivery systems. Hepatitis B, human papilloma virus, and measles vaccination programs rely on strong maternal and child health services. Polio eradication efforts have to be accompanied by rehabilitation services for those disabled by polio disease. And for all vaccine-preventable infections, further outbreaks can only be prevented if there are effective surveillance systems in place that can ensure rapid containment of new infections. Just as vaccine has been the cornerstones for a range of disease elimination programs, the development of effective therapeutics supported by reliable diagnosis has been game changers for other disease elimination programs. The introduction of highly active antiretroviral therapies in 1996 transformed the HIV response overnight from a focus on mitigating the impact of deadly epidemics to adopting aggressive efforts to end AIDS as a public health threat by 2030. Innovations in antiretroviral therapies and HIV diagnostics has been truly transformative and one of the great public health successes of the 20th century. However, even before the antiretroviral therapies became more widely available, community mobilization and implementation of basic public health measures such as comprehensive harm reduction programs controlled and reversed HIV epidemics in many communities. Condom programming, behavior change, and community solidarity contained HIV epidemics among the community of sexual workers and men who have sex with men in both high and low income countries. Now, even where we have extensive coverage of antiretroviral therapies, HIV epidemics continue to exact a high toll on many communities. No longer dying from the AIDS, people living with HIV are confronting major comorbidities such as diabetes, cardiovascular diseases like cancers, and mental health disorders, and are at risk of co-infections such as viral hepatitis, other sexually transmitted infections, and tuberculosis. The challenges of managing HIV as a chronic health condition strengthen further progress in the HIV response with the increasing rate of HIV drug resistance, poor adherence to treatment, continuing higher levels of stigma and discrimination, and economic hardship. There are further examples of how some communicable diseases can be controlled even in the absence of effective vaccines or therapeutics. The guinea worm disease eradication campaigns launched in 1980 has almost achieved its eradication goal with only 54 human cases reported worldwide in 2019, and only 7 countries yet to be certified free of guinea worm disease. With no vaccines or medicine available, eradication is being achieved through the provision of safe drinking water, vector control, health education, community mobilization, surveillance, and guinea worm extraction and worm management. These case studies clearly demonstrate the critical importance of robust health and community systems and multi-sectoral action for communicable disease control to be achieved and sustained. As countries approach their disease elimination targets, the performance of their respective health systems will be the major determining factors for success. Weak and fragmented systems will prevent progress, even for the best resource disease-specific program. Ladies and gentlemen, elimination of single disease is a huge challenge for any country to achieve, requiring exceptional political commitment and considerable resource. However, at the global level, commitments has been made to eliminate or eradicate over 30 diseases in this decade, most communicable diseases. Some countries have committed to eliminate as many as 8 major diseases at the same time. How realistic are these commitments at a time when even the best resource disease elimination programs are off track to meet their elimination targets? Clearly, if we are to achieve these targets, our approach to disease elimination must change. Transforming disease elimination programs under the framework of universal health coverage provides such a pathway. A successful programs must be health system-based, providing the people-centered approach. Investing in primary health care that provides the holistic care is essential. I would argue that the elimination of multi-diseases at the same time will require the country's health systems that can deliver in 5 areas. First, the country health information systems needs to generate and use strategic information across all major diseases relevant to the country so that it can make the better decision and monitor progress. Second, using this integrated information, each country should develop strategic and plans for integrated multi-disease elimination. Third, each country should define integrated multi-disease elimination service package which focus on primary health care. Priority should be given to those public health interventions that will impact on multiple diseases at the same time, such as vaccine programs, water, sanitation and hygiene, and harm reduction for the people who use drugs. Fourth, the health and community systems need to be adapted to deliver integrated and high-quality services where they are most needed, reaching those populations most vulnerable. And fifth, each country should review or reform its health financing system to ensure that essential disease intervention and services are included in the National Universal Health Coverage Package and delivered to the community without resulting financial hardship. In these extraordinary times of the COVID-19 pandemic, the needs for strong health system and community system, multi-sectoral actions have never been greater. The pandemic has revealed weakness in the health systems of all countries, rich or poor, north and south. These are the same weaknesses that are impeding the progress in the elimination of HIV, tuberculosis, malaria, hepatitis, measles, guinea worm diseases, trachoma, and other communicable diseases, and more broadly in combating non-communicable diseases and mental health disorders. Ladies and gentlemen, even before the pandemic, the world was off track to meet most of our targets outlined in the 2030 Agenda for Sustainable Development. climate change, food insecurity, civil conflict, increasing inequalities in wealth, economic downturns, and the global political tension have made the world a fragile place. As the pandemic grows, it's continued to disrupt essential health services, including those for disease elimination. Such disruption will increase the mortality rates worldwide, including for major diseases. Although it may take some years before we fully comprehend the full public health and social economic impact of this pandemic, we must act now, plan for the future. We cannot return to the world as it was before 2020. We must have a vision for a different future, a different approach to public health, and a different pathway to disease elimination. While the investment required to fund the COVID-19 response, achieve the global health targets, and to build stronger health systems may be measured in the hundreds of millions of dollars and the millions of lives lost, the cost is still only a fraction of the trillions of dollars of damage already caused by COVID-19 pandemic. COVID-19 crisis has provided a wake-up call and also the opportunity to mobilize global solidarity to tackle not only the pandemic, but many other global health and development challenges. Already the emergency response to COVID-19 has been exceptional with new mechanisms in place to accelerate the development of vaccines, therapeutics, and diagnosis, and to support country and community in crisis. The access to COVID-19 Tools Accelerator, or ACTA, is one of such initiatives that is transforming the way in which we innovate, mobilize new partnerships, and take actions in countries. But the emergency response must be complemented by long-term planning. This is time to invest in a recovery that will build back a better world and to reshape our communicable and non-communicable disease programs for the new world we will be living in. To build a health system that will enable us to defeat COVID-19, protect us from any future pandemic, and to achieve our common shared targets of universal health coverage. This will require the support and actions of a public health world. Each one of you has a critical role to play in building a better future for us all. I thank you for your attention.
Okay, thank you so much again to Dr. Ren for joining our conference and for sharing those words with us.